Yeah, let's go for it.
All right. Welcome to the webinar, everybody. This is Bob Hollis with Mobius Intelligent Systems providing hosting services today. The webinar is being recorded and will be made available to you on a website that Nate will be showing you later in the webinar. All attendees are muted by default, but we encourage questions. So please use your question panel to enter any questions as they come to mind. We may answer some of them relevant to the direct content as we're going through the webinar. And then there'll be additional time at the end for any that weren't answered during the webinar. If you need technical support, the best thing to do is go to gotowebinar.com, resources and FAQs, and it should be able to help you pretty quickly. And with that, I will turn it over to Nate.
Great, thank you so much, Bob. We appreciate you and your hosting services. So today is webinar 4. This is Nate Pelzer, Program Manager at California Product Stewardship Council. Today we'll be talking about the Department of Healthcare Services Drug Take-Back Program, webinar 4. This will include a substantial amount of repeat information from the previous 3 webinars. If this is your first webinar, welcome. If you've heard our earlier webinars, welcome again to you. This will be recorded, as Bob mentioned, and posted on our website, takebackdrugs.org, typically within 1 business day of receiving the file. So looking forward to sharing this with you soon. Just wanted to start off by explaining who we are, California Product Stewardship Council, also known as CPSC. We are the designers and the administrators of the California Drug Take-Back Program. And I just wanted to share with you some information about what else we do. We're a 501c3 nonprofit based in Midtown Sacramento. We were formed in 2007. And our mission is to really shift California's product waste management system from one that's focused on taxpayer-funded, government-funded, to one that's focused on putting the financial responsibility back onto the producer of the product. The end game really is to reduce public costs, drive improvements to product design, meaning green design, and of course promote environmental sustainability. And you can see our vision on this slide as well. Producers have the primary responsibility to establish, fund, and manage end-of-life systems and products. What we'd like to see is we'd like to see the state step up and set specific performance goals, create systems that ensure accountability and transparency, of course, but essentially have the producers create, establish, fund, and manage the end-of-life system. You can see the picture on the right of the team here, small but very effective team. Let's jump to the next slide, the Drug Take-Back Program overview. So we're super excited about this program. It's been up and running for a number of months now. We've already gone through 1 complete cycle of MedBin awards. That was round 1. We're now into round 2. So if you're interested in obtaining a MedBin, certainly let us know. We're accepting applications for additional MedBins as part of round 2. But the end goal of the program is to install about 300 MedBins throughout the state of California free of charge. As I like to say, this program is soup to nuts. It includes free MedBins. We'll pay for disposal of the medications collected through August of next year. We'll host 5 webinars. This is the 4th of the 5. And we'll certainly provide collectors with technical support, any assistance they might need in regards to the installation of the MedBin, the collection of the unwanted medications, shipping the packaged liners back to the waste-to-energy facility. And of course, our aim is to increase public and healthcare community awareness of safe medicine disposal. People need options. They really need to learn and understand that it's not a great idea to throw your unwanted medications in the trash, to put them down the toilet. The most ecologically way to dispose of those unwanted medications is by putting them into a MedBin. And that's exactly what we're doing with this program. This program is funded by a grant from the Department of Healthcare Services here in California. We're really excited to partner with the Department of Healthcare Services. This is our first time doing so. It's been a great experience. We're so happy to have such supportive and wonderful partners. So thank you to DHCS for your partnership. I'm often asked how to qualify to become a MedBin host. It's pretty easy. We've got a survey that would need to be filled out that asks a number of questions. Surveys typically take between 5 and 7 minutes to complete. Once you've answered the questions in the survey, you can essentially know if you qualify to be a MedBin host, which again, it's quick and easy. There's one stipulation though. So a number of counties around the state already had MedBin programs. They had ordinances that essentially initiated some kind of MedBin program that's already funded by the pharma companies via local ordinance, local statute. So those counties are listed here. It's Alameda, Contra Costa, Marin, San Francisco, SLO, San Mateo, Santa Barbara, Santa Cruz, and Santa Clara. So if you're one of those counties, unfortunately, you don't qualify for the California Drug Take-Back program. If you're outside of one of these 9 counties, we would encourage you to apply. We're offering MedBins to pharmacies, hospitals with pharmacies, and law enforcement offices. Again, if you qualify as one of those 3, we would encourage you to move forward with the survey, which can be found at takebackdrugs.org. One thing that I like to talk about on each of the webinars is that there are a number of federal, state, and local protections that are in place to ensure that the drugs are handled with care and that you, of course, the MedBin host, your staff, and consumers, just in general, are kept safe. So those regulatory bodies are shown on the screen. We've got the federal level, that's the DEA, the Drug Enforcement Agency. At a state level, it's the California Board of Pharmacy. At the local level, it's likely your Department of Health, your Department of Human Services. It could be other similar organization. Unfortunately, we don't have that information at a local level, so we would leave that up to you to reach out to your Department of Health or your Department of Human Services to see if they have any special protections or regulations in place that you would have to comply with. From the few that we're aware of, it's simply been a form that requires MedBin hosts to register so they know where the MedBins are located so that they can help promote you. So again, reach out to your local Department of Health or Department of Health Services to find out if there are any protections or regulations in place to help protect you and consumers. So let's walk through each of these regulatory organizations just so you have a better understanding of what their role is and what they're doing. So at the federal level, I mentioned it's the Drug Enforcement Agency. They have a couple things they'd like you to fill out, one of which is a registrant fact sheet. So they want to find out who you are, where you're located, some additional details about you as a collector. The rules that are established via the DEA are part of the Disposal Act of 2010. It was published in 2014. And we've got all this information posted on our website for your convenience. And I've also got the link here as well. I would encourage you to read the Disposal Act. It's short and sweet. Just sets forth a number of rules that have to be in place, again, to ensure protection, your protection, the consumer's general protection, make sure that everyone's safe. So that, again, is the federal level, the Drug Enforcement Agency. At a state level, we've got the California Board of Pharmacy. They've also been a partner in this program with us. They did just a wonderful job spreading the word around to each of the pharmacists throughout the state about the California Drug Take-Back program. Thanks to the California Board of Pharmacy for doing that. We really appreciate it. The board, of course, has its own set of requirements and regulations. In order to be a MedBin host, you have to be licensed by the board, which is simply a registration process. They have some guidelines about the MedBin location and observation, meaning specifically, the pharmacist has to be able to see the MedBin from their position in the pharmacy. So at the drug drop-off and pick-up locations at the pharmacy, for example, the pharmacist would need to be able to see the MedBin as it's permanently mounted there. And they also have some very specific requirements regarding the disposal process. The California Drug Take-Back program complies with each of the requirements set forth by the DEA and the California Board of Pharmacy. If you'd like to see what those full regulations are, I'd encourage you to take a look at 16 CA ADC subsection 1776. This is also relatively short. I think it's around 7 or 8 pages, and it has some really good information, specific things that everyone as a pharmacist or a hospital with a pharmacy would need to know if they wanted to host a MedBin. I've got some additional resources there as well. Let's move on to the next. Possible local requirements. This is what I mentioned earlier about contacting your Department of Health or your local Department of Health Services or other similar department in your city or county. Again, it's unlikely that they'll have any additional requirements or regulations that are specific to MedBins, but it's definitely worth checking out. And it's just a simple phone call or email away to reach the contact at that specific department. Let's move on to the next slide. So I wanted to spend some time talking about the disposal process. Most of the questions I get pertain specifically to the disposal process, so just wanted to share this with you. Again, the program is soup to nuts. It includes the bin, professional installation. It includes free liners and free servicing through August of 2020. So once the bin is installed by our professional installer, you'll receive via the mail a pack of 4 liners. So one would be put into the med bin by you, and the other 3 would be safely stored away, out of the way. Unpacking and assembly of a liner is very easy. In fact, we've created some videos and have posted those to YouTube and to our website for your convenience. Each video is about 2 or 3 minutes long. It's very commonsensical. I think you'll appreciate the video. So please take a look. If you're a MedBin host, or if you anticipate being a MedBin host very soon as part of this program, definitely take a look at the website. It's got a lot of very useful videos for you to review for reference purposes. Once the bin is filled, note that you don't call for pickup before it's filled. Just want to make sure that everyone's aware of that. Once the hatch on the top of the metal med bin is no longer able to close properly, you know it's full. And what you would then do is you would open up the web portal and call for pickup. And then you would proceed to remove the bin. You and an assistant would, remove the liner rather, from the bin and package it up. And it includes all of the necessary tape as part of the liner. So you would fold in the plastic interior liner, which is contained in the cardboard liner, seal up the plastic interior liner, and then seal up the cardboard box, which again is the entire liner. Those 2 comprise the entire liner, and then it's ready to be shipped. So the common carrier typically shows up within 1 business day and then takes the box, which is the removed liner, packaged liner, takes it away to the waste to energy facility. So I've got some additional details shown on the slide. I just provided you essentially with an overview of the process of removing and shipping. I will mention something that I just referred to, which is the web portal. When we first started this project, we thought it was going to be a very paper-intensive tracking system, but we're very happy with the web portal we've been given access to from Covanta. It allows you to log in, set up a number of very specific users, and call for pickup using that exact same site. So we're happy with it because it requires the use of less resources. It's very easy to do. You have access to all the records you need to comply with DEA and BOP Board of Pharmacy rules. So again, we'll be using a web portal for this program, not a paper-intensive tracking system, which some of you might have seen or used in the past. Envelope overview. So part of this program, California Drug Take-Back Program, is a pilot program in which we distribute drug take-back envelopes to interested parties throughout the state. So we're working very closely with the DHCS, and we anticipate wrapping up our preliminary pilot program and then actually moving forward and starting the pilot program sometime in the next few weeks. So the tentative agreement between us and the DHCS is to start with 1 or 2 large counties, 2 or 3 medium-sized counties, and then probably the same quantity of smaller counties, distribute the envelopes to folks in that area, such as opioid coalitions or nursing homes, so that they can give the envelopes to folks that typically can't get to the med bins. So we're really excited again to have this envelope portion of the project as well. We'll be sharing information on our website about this once it's finalized with the DHCS, and again, we anticipate that'll be in the next few weeks, and then we'll probably start that program in about a month. Press and media. So one of the things that we're also very excited about with this program is our promotion of you as a MedBin host once the MedBin is installed. So again, we're really shooting for community benefit here. The community needs to know that it has new options when it comes to disposing of their unwanted medications that have been piling up in their drug cabinet. And they need to know that there's one near their home. So what we do is we put your location of the new MedBin on our map that we have on our website, takebackdrugs.org. We also publish a number of posts on social media about the new MedBin location, meaning your pharmacy, your hospital, or your law enforcement office. And then we also include mention of you and the new MedBin location on our listservs, on conference calls, on press releases, In fact, we'll be releasing a press release for each individual MedBin host. We've got a number of them queued up to be released this week for the 9 MedBins that we've installed already to date. And yeah, so this is a great way to drive traffic to your location, whether it's a law enforcement office or a pharmacy or a hospital with a pharmacy. We think that everyone will benefit as a result of the MedBin and the increased traffic. The next steps. The nice thing with the California Drug Take-Back program is it's very easy to apply. I've got the link for the application here. It's also on our website, takebackdrugs.org. As I mentioned before, it only takes 5 to 7 minutes to complete the application, but we ask that when you sit down to complete the application that you have on hand a number of pictures of where the receptacle would go in your facility. So we'll need electronic versions uploaded as part of the survey completion process. Once we receive the survey, we'll review the contents just to make sure that you qualify, that you're DEA compliant, that you're Board of Pharmacy compliant if it's applicable. And then we'll reach out to you with hopefully some very good news about you being a new recipient of a MedBin. Now, I know I've mentioned the Board of Pharmacy a number of times, and chances are some of you on the phone wouldn't have to comply at all with the Board of Pharmacy requirements because they don't apply, those regulations from the Board of Pharmacy don't apply to law enforcement offices. So if you'd like to discuss that further, I'm more than happy to have a phone call or email. Reach out to me in any way you possibly can. I've got my contact information as part of the slide deck, and I would love to chat with you about what steps you need to take to move forward as a law enforcement office. So again, please complete the application. Make sure you have pictures on hand of where the receptacle will be located. Then go to takebackdrugs.org to complete the application, and then we'll be in touch with you regarding next steps and what we can do to get that MedBin installed. So this portion of the webinar, I always take questions, and just want to encourage you to ask any questions that might have popped into your head throughout the webinar. Let me know of any concerns, again, or questions that you might have. I don't see any logged in. If you'd like to ask a question, please do so now. While I'm waiting for questions to pop in, what I'll do is I'll flip over to the website so you can see that we have the main page, of course, California Drug Take-Back Program. Got some details about how it works, what goes into the MedBin, how to apply, and how to find a bin. I'm going to scroll down. You can see we've got the map here of all the MedBins located throughout the state of California. We're in the process of updating this to reflect the new ones that we've just installed, but we've got some from previous CPSC programs listed here with the purple pill, and then MedBins that are part of statewide efforts or other programs in blue. As I scroll down, got some reference materials. Wanted to jump down to the FAQ section. You can see that I've logged all the questions that we've heard from the previous webinars and from a number of phone calls and emails that I've received regarding the program. So I would encourage you to take a look at that. You can see I've also got links to the videos that show you how to unpack and assemble the liners, and then of course pack and ship the liners. Excellent videos, super short, very informative. Wanted to scroll down to the bottom. One of the most popular questions I received is, what do we do to pay for the servicing past August of 2020? Earlier I mentioned that the program soup to nuts. It includes, of course, the bin, installation, servicing as well through August of 2020. We're working with the state and other entities to secure funding for servicing past August of 2020. Unfortunately, we haven't been able to confirm anything solidly. We haven't been able to confirm any kind of funding past August of 2020, but we're working and moving down that path. And what we've seen and what we've heard from a number of different entities to date is promising, but I'm just not in a position yet to say that we have funding for servicing past the end of this program, again, past August of 2020. So you would be, as a MedBin host, responsible for paying for the servicing. Covanta charges $165 per service. And just as an example, so you can gauge how often you have to get the MedBin serviced, and again, it's going to vary from site to site. We have one here in Midtown, Sacramento, that's serviced on average once every 1 to 3 months. So it's not very often. The costs aren't very high, but there is a cost associated with it. Again, we're working on securing funding, and we hope that that certainly works out to save you from having to pay the $165 per service fee. Looks like I just got a question. Let me open this up and I'll share it with you. Can local health departments obtain a bin? Unfortunately not. The DEA is very strict on where med bins may be located, and it's a very short list. This program is even more specific, meaning that we're only allowing the bins to be placed in either a pharmacy or a hospital with a pharmacy or a law enforcement office. So as much as we'd like to place the bins in the health departments throughout the state, we simply can't per DEA. Again, that's Federal Drug Enforcement Agency guidelines, and as part of the terms of this specific grant. Okay, another question just came in. To confirm, are these bins for law enforcement, hospitals, and pharmacies? Yes. That's exactly what they're for. If you're a law enforcement office, or if you represent a hospital with a pharmacy, or if you simply represent a pharmacy, please apply for the bins. Again, we're in round 2. We're accepting applications, and we would encourage you to apply. The next question that just came in is, the health department could pass out the envelopes. Is this a possibility? Yes, it's certainly a possibility. As part of the pilot program that I mentioned earlier, we're working with a couple different health departments in a couple different counties. I would expect this pilot program to be a success because the folks we're working with are very eager to get the envelopes out and into the hands of the folks that can use them and need them the most. So I would expect this program at some point to go statewide once funding's secured, which means that the DHCS, Department of Healthcare Services, might distribute to health departments across the state additional envelopes. So we'll keep you posted on that. We would love to see that happen. I can't speak for the DHCS, but I feel like that's the general direction or one of the options that they're considering at this point. But again, it depends on the results of the pilot program. If you have any other questions, please go ahead and submit those now. And I'll move back to the web page. Okay, another popular question is regarding the liners. So I mentioned that when you get the med bin, we'll ship to you 4 liners roughly about a week later. The web portal has a small little box that you can check, and I would encourage you to do this once you get the med bin and once you register with the portal, that allows you to get an automatic replenishment of the liners, again, through the end of August of 2020. So all the liners are included for the duration of the program, which is wonderful. If you want replacement liners, once you burn through the 4 that are provided to you after the installation of the med bin, definitely go into the the web portal and check that little box. We provide to you, as part of this program, process documentation that shows you each and every step you need to take to register through the web portal and make sure that you have that little box checked for automatic replenishment of liners. So we've got you covered there. But that's simply all you need to do to make sure that you get serviced and that you get the replacement liners when you need them. After you burn through the first 3 of the 4 that are provided to you, and if you have that box checked in the web portal, you'll get shipped another 3-pack of liners for use. Just skimming through a couple other questions. I think we've covered each of these items here. Again, I can't recommend enough that you watch the videos for unpacking and assembling liners and for packing and shipping the liners. They're super useful. Please do that. And I will also mention that this webinar will be recorded and will be posted to YouTube and then, of course, to the website. So if by chance you'd like to share this with somebody who you think might be interested in MedBin or the envelope program, please feel free to share the website or the link to the recorded version of this webinar with those people. And of course, let me know if they have any questions. Not seeing any other questions. I will say please connect with CPSC. My name is Nate Pelzer. I'm a program manager here at CPSC, and I'm currently running the California Drug Take-Back program. You've got my office number and my cell phone shown there on the screen, and of course our website. Check out takebackdrugs.org for more information, or give me a call or shoot me off an email, and I'll respond as quickly as I possibly can. Again, thank you for your time. Thank you for listening in on webinar 4, and I hope to hear from each of you soon, and I hope to see an application for MedBin. Thank you so much and have a great day.